So hello friends, welcome to Sayyadi H online classes. So today we are going to start the topic heart. Okay, basically very important topic. In this chapter, we are going to talk about anatomy and physiology of heart in detail. Okay, so let's start with the introduction of heart. So basically, in the embryo means during pregnancy. Okay, during development of the fetus. Okay, so the heart begins to beat at 4 weeks of age. So when the pregnancy is confirmed, after 4 weeks, first organ which will start, that is heart. Okay, even before the nerve supply has been established. Okay, but here one thing you have to remember that after heart, the body will get the nutritions. But even before, the nerves which are present in the body will establish even before heart. Okay, but nutritions will be supplied after 4 weeks from the heart pumping. Okay, so third thing you have to remember that from the mother womb, okay, he will get all the nutritions. Okay, umbilical cord. Okay, this is the third thing you have to remember. If a person lives to be 80 years old, his or her heart continues to be beat an average of 1 lakh times a day. Every day for each of those 80 years, imagine trying to squeeze a tennis ball 70 times a minute. After a few minutes, your arm muscles would begin to tire. Then imagine increase your squeezing rate 120 times a minute. Most of us could not keep that up very long. But what the heart does during exercise. A healthy heart can increase its rate and force of contraction to meet the body's need for more oxygen, then return to its resting rate and keep on beating as if nothing very extraordinary had happened. Okay, extraordinary happened. In fact, it is not extraordinary at all. This is the job the heart is meant to do. The primary function of heart is to pump blood through the arteries, capillaries, and veins. As you learned in the previous chapter, blood transport oxygen and nutrition and has other important functions as well. The heart is the pump that keeps blood circulation properly. So basically here, one thing you have to remember that is during the embryo, uh, in the fourth week, the heartbeat starts. First thing you have to remember. Second thing, in per day, 1 lakh times the heart beats. Okay. So here one example is given that if you squeeze one tennis ball, okay, for 70 times a minute, your arm muscle will be tight. Okay. So then how could the heart is pumping, is squeezing and relaxing, contracting and relaxing, contracting, relaxing is happening. Okay. Minimum in 1 minute, 70 to 90 times per minute, the heart beats 70 to 90 or 100 times a minute. Okay. So for 80 years, if you calculate, so okay, your calculator doesn't give the answer. Okay. In 1 day, 1 lakh times. In 30 days, 30 lakh times. Okay. 365 days, 365 lakh times. 365 into maximum lifespan is 60, minimum 80 to 90. So you multiply it. Okay. So you cannot imagine how the heart works. Okay. Here is given that it is the duty of the heart. But if you if you see in natural way, It is a gift from the God. Okay, so we have to protect it. We have to protect from diseases, various diseases. Okay, then only the heart beats in normal way. So basically, the if the heart is physiologically okay, then what will happen? It will give the necessary amount of blood to all parts of the body. It is only pumping organ. Okay, pumping organ. So basically, with the help of arteries, veins, and capillaries, it will give the blood to the body parts, and it will take away the venous blood or deoxygenated blood from the body parts. So this is the only two functions are there for the heart: pumping and relaxation, giving oxygenated blood, taking deoxygenated blood. This is the function of the heart, simply. Okay. So here we will talk about now some anatomy of the heart. So basically, where is heart located? Heart is located between the thoracic cavity. Okay. So heart is located in the thoracic cavity between the lungs. So here we have the two lungs. In the between we have the thoracic cavity. In the thoracic cavity we have lung. Okay. This area is called mediastinum. So what that area called? Mediastinum. Here no image is given. Okay. So if we draw imaginary line, basically the left side of the heart is slightly curved. Okay, like this. Okay. So this is the location of heart. Okay, this is the location of heart. We will call this area is mediastinum. Okay, mediastinum. Okay. This base of cone-shaped heart is uppermost behind the sternum, and great vessel enter or leave here. The apex tip of the heart points towards and just above the diaphragm to the left of the middle line. This is why you may think of the heart as begin on the left side because the strongest beat can be heard on felt here. So basically, so this is the heart. Okay. So this is the heart. So this is the tip of the heart. We will call apex. So here the outermost strong sound of the heart can be heard. So whenever cardiologist or any physician want to hear the heart sound, okay, he will keep his stethoscope here in apex area. So he can hear the heart sounds. What he will do? He will hear the heart sounds. So whenever in your clinic also, if you want to listen the heart sounds, so you have to take the stethoscope and put on the apex area. Okay, this is the thing we have to remember. Next is the heart is enclosed in the pericardial membrane, which there are three layers. The outermost layer is fibrous pericardium, a loose fitting sac of strong fibrous connective tissue that is extended inferiorly over the diaphragm. So basically, if you see the body, so it is a diaphragm. You know diaphragm. Okay, it is divide the body from outer part to middle part. So here we have the thoracic cavity. Here we have the abdominal cavity. This space is known as cavity. So in the thoracic cavity, you have lungs, heart, and pericardium, and trachea, and esophagus. So these are the organs are present below the diaphragm. Diaphragm is here. Okay, below the diaphragm we have stomach, small intestine, large intestine, pancreas, spleen, gallbladder, liver. So these are the organs. So basically, the above the diaphragm we have heart. So heart in the heart here we will put the if you put the uh, stethoscope here, you will able to hear the heart sounds. Okay. So here we have the three things we have to remember. This is the Heart, one tissue is cut piece of tissue is seen here. Okay, so basically first layer. This is the first layer. It is called pericardial sac or fibrous pericardium. Okay, in the acupuncture we have pericardium. Okay, you know the pericardium. So fire is generated by pericardium. Okay, so here and other meaning of pericardium is also brain. Okay, spinal cord also, triple O spinal cord, whatever the name is given. Okay, here pericardium is covering of the heart. What is the second here in the physiology of body? Here we have pericardium. The second is partial pericardium. Okay, partial pericardium. This is the fibrous pericardium. Next is partial pericardium. Next we have some space. Here we have the space. That is pericardial cavity. In that pericardial cavity, we have in this pericardial cavity, we'll learn in some paragraph. Okay. So here we have the cavity. Then above the cavity, we have epicardium. This is the pericardium. This is the partial pericardium, pericardium cavity, epicardium. In the after epicardium, we have myocardium, the main heart muscle. Okay, myocardia, myocardia, myocardium. In the myocardium, we have endocardium inside the heart muscle. Okay, this is the name of the uh, layers of the heart. Okay, you have to remember. Again, we have mainly three layers. Okay, this is the pericardium outer side. This is partial. This is myocardium, and inside epicardium. Okay, these are the three layers you have to remember. The names and you have to draw the diagram. Then only you will be able to remember. Okay. Here, one question is given, what is found between the partial and visceral pericardial layers and what is the function? So I told you that here we have the pericardial cavity. Okay, in the pericardial cavity, we have serous fluids. What we have? Serous fluid, which prevents friction as the heart beats because, okay, so it is work as a glue or any thick fluid which will reduce the friction between these two layers. Okay, so this is the use of serous fluid. So again I will repeat all this thing in Hindi also. तो यहाँ पे हम बात करेंगे हार्ट के बारे में. हार्ट बेसिकली ये दो लंग्स होते हैं, दो लंग्स के बीच में स्पेस होता है जिसको मीडियास्टेनियम कहा जाता है. मीडियास्टेनियम के बीच में यहाँ पे हार्ट होता है. हार्ट जो है निचला हिस्सा जो है उसको टिप कहते हैं, जिसको एपेक्स कहते हैं. जो आपके जो लेयर है जिसको हम कहते हैं डायफ्राग्राम, डायफ्राग्राम के बिल्कुल ऊपर होता है. डायफ्राग्राम ये डिवाइड करता है अपर बॉडी कैविटी, थोरेसिक कैविटी एंड एब्डोमिनल कैविटी. सो हियर वी हैव द एपेक्स. यहाँ पे एपेक्स है. जब हम ज्यादातर डॉक्टर्स एपेक्स पे ही हार्ट बीट को देखते हैं. ठीक है, एपेक्स पे क्या देखते हैं, वो अपने स्टेथोस्कोप पे लेते हैं, स्टेथोस्कोप हार्ट बीट एपेक्स एरिया पे लगाते हैं और हार्ट बीट चेक करते हैं, हार्ट साउंड्स को चेक करते हैं. ठीक है, तो ये हो गया थोड़ा बेसिक इंट्रोडक्शन. अब हम बात करेंगे लेयर्स के बारे में. एक पीस ऑफ, अगर आप एक पीस के हार्ट के एक पीस को लेंगे, एक टिश्यू को लेंगे या फिर एक सेल को लेंगे, तो उसमें तीन लेयर्स देखेंगे. ठीक है, एक है आपका फाइब्रस पेरिकार्डियम. ये फाइब्रस टिश्यू से बना हुआ, एकदम एकदम कनेक्ट है और स्ट्रांग है, बहुत स्ट्रांग होता है, स्ट्रांग फाइब्रस कनेक्टिव टिश्यू. ये आउटर साइड है. ठीक है, फिर अब फिर यहाँ पे दो और मेम्ब्रेन है देखने को मिलेंगे आगे। यहाँ पे पार्शियल पेरिकार्डियम, उसके बाद एक कैविटी है, खाली जगह है जहाँ पर सीरस फ्लूइड होता है। उसके बाद एपिकार्डियम या फिर वेसिरल एपिकार्डियम देखने को मिलेगा। उसके बाद मायोकार्डियम, उसके बाद एंडोकार्डियम। यानी ये सेकेंड लेयर का बाहर की हिस्सा, अंदर का हिस्सा, ये दोनों के लेयर के बीच में आपको पेरिकार्डियल कैविटी मिलेगा और वहां पे सीरस फ्लूइड मिलेगा जो फ्रिक्शन को या रगड़ रगड़ जो पैदा होता है उस रगड़े को रोकता है। ठीक है, तो ये हमने देखा यहाँ पर हार्ट के एनाटॉमी। अब हम बात करेंगे चैम्बर्स, वेजल्स एंड valves के बारे में। Here now we will talk about chambers, vessels and valves. So basically there are four chambers. This is the heart. So this is the heart. Okay, you have to divide into four chambers. These are the chambers. This is one chamber. This is one chamber. This is one chamber. This is one chamber. In the real diagram you can see here. Hmm. So this is one chamber. Okay, and another one is this chamber. Okay, another one is this chamber. Okay, another one is this chamber. So we have four chambers. What are the names of the chambers? So whenever you want to remember heart, one thing is you have to remember. This is they are the four chambers and they are divided. Okay, here we have the one division and one division is here. Okay, you can see here. तो यहाँ पे देख सकते हैं हार्ट की फोर चैम्बर्स। फोर chambers mean four rooms. Okay, here one room, room number one, room number two, room number three, room number four, or else one, two, three, and four. So this is the right part of the heart. Okay, this is near the right lung. This is near the right side of the lung. So this is right side of the heart. This is near the left lung. This is the left side of the lung, left side of the heart. This is the right side. This is the left side. You have to remember. Second, first thing is four chambers. Second thing is this is the right side of the heart. This is the left side of the heart. So what are the names? Second is names now. So names are like that. This is the right atrium. What is that now? Right atrium and right ventricle. Okay, next is left atrium, left ventricle. So they are the four chambers of the heart, and this is the right side, this is the left side. Right side name is right atrium, right ventricle. One number is above. Atrium is above. Okay, this is below ventricle. Both are ventricles. Both are ventricles. Here also name same. Ventricle, ventricle. Atrium, atrium. So right side of the atrium, left side of the ventricle. Right side of the ventricle, left side of the ventricle. So these are the four things you have to remember. Understood here till? So यहाँ पे हम हार्ट के बारे में जानेंगे। हार्ट की कितने चैम्बर्स है? हार्ट के चार चैम्बर्स, चार कमरे हैं। ठीक है, कितने कमरे हैं? हार्ट के चार कमरे हैं। चार कमरे में जिसका नाम है राइट साइड एक दो कमरे हैं, लेफ्ट साइड दो कमरे हैं। तो राइट साइड के कमरों का नाम, फर्स्ट कमरा है राइट एट्रियम, राइट वेंट्रिकल, निचले वाला। ये वाला राइट लेफ्ट एट्रियम, लेफ्ट वेंट्रिकल। So we have to remember the names. The chambers are lined with endocardium. So and this innermost part of the heart, you can see in the chambers space. This is the room space. I call it. This is the, if you imagine right atrium, so you can see endocardium. Simple squamous epithelium also covers the walls of the heart and continue into the vessel as the lining endothelium. The important physical character of the endocardium is not its thinness, but rather its smoothness. So basically, endocardium is covered by which cell? Squamous epithelium cell. First thing. Second thing is you have to remember that its smoothness is very important. What is important? It smoothness is very important. Okay. The important physical character of not this very smooth tissue prevents abnormal blood clotting. So what is the its work? It will prevent the blood clotting. Okay, because clotting would be initiated by contact of blood with a rough surface. What is the physiology here? Because endocardium is made up of squamous cell. Okay, so first thing, second thing is the smooth cells. Because whenever blood contact with rough surface, what will happen? Blood will clot. But here is it is smooth surface. So there are the rare chances of clotting of blood. I told you upper chamber is left atrium, right atrium, left ventricle, right ventricle. Okay. Next, we have to remember that how they are divided. How they are divided. So the chamber's name you have to remember. This is the intraventricular septum. What is the name? Interventricular septum. Okay. So right at ventricle, left ventricle is divided by interventricular septum. Okay. And left, right article, left atrium and left atrium. Okay. It is divided by, here we have the name in all given here, I think so. Interarterial septum. I think it is interarterial septum. So likewise here we have the one wall, that name is interarterial septum. So here interventricular septum, interarterial septum. Okay, so I think why these are the chambers, these are the walls, because blood will not mix. This is the deoxygenated bed, this is oxygenated bed. So blood will not mix from here to here, from here to here. So from here to here, from here to here. So that's the reason they are the walls, interventricular septum and interarticular septum. So I think we can stop here only. Okay, because from here there are the some important things. Okay, from here, if you understood from here till here, you can able to understood after that also. So please draw the diagram and label it. Okay, this is the homework for you. So we will meet tomorrow. If any doubts, you can ask.